Today's video is a series of gentle stretches and warm-ups for my patients who may be having low back pain, SI joint pain, sciatica, pelvic floor discomfort, menstrual cramps, constipation. Hi, I'm Dr. Lindsay Trottier. I'm a doctor of acupuncture and Chinese medicine practicing in San Diego, California, and this is going to be a gentle warm-up and eventually a more involved stretch that's going to help release the pelvic floor, help get some mobility through the adductor, and help with back pain. So what you're gonna need is a chair. This would be very good to review my sitting to standing video to understand how I want your hips positioned in this chair. Step one of this video is just a gentle movement, do not have any discomfort. This is a dynamic stretch. So step one is you're going to place your hands on your knees and you're going to gently shift side to side toward the opposite knee. You can do this for 30 to 60 seconds. And where you should feel this is back here in the sacroiliac joint or across the low back. And you might even feel it under your legs and the hamstrings and in your thighs. So just a gentle back and forth. This is step one. If you feel any pain, stop. If you feel a stretch, good. You might do this for a few days and make sure that this doesn't make anything worse. The second step is going to be a static stretch. So after you've done your warm-up, you're gonna pick a side and pushing onto the inside of the leg, not the knee. You're not pushing into the knee, you're pushing onto the inside of the leg. You're going to lean toward your opposite leg. Okay, so diagonally across, and you're going to feel that stretch through the quadratus lumborum, down the back, even into the hip maybe. And then as you put some resistance, a little stretch through the thigh, hold for 30 to 60 seconds. This is step two. And then you're going to switch sides. Okay, hold. And then you can go back to step one. Get a little bit more mobility. Step three is after you've done step one and step two, and you've done this for a few days and your pain hasn't gotten worse, and now this is feeling easy, is you're going to lean forward and you're gonna work on getting your elbows between your legs, not pushing on the knee joint, but just above it. So if you put your hand on your knee, 4 fingers in, that's about where your elbow's gonna go, okay? So you're gonna lean forward. You're gonna lean forward, get your elbows in, and then using your hands as a counterbalance, push, okay? Now, I don't want to see your back rounding. This is not it. This is not good for us. So if you feel like you're here and you can't get to a straight back, you're not ready for step three. You need to do this for a few more days. And then maybe check out the rest of my posture playlist. So here, you're gonna hold for 30 to 60 seconds. And then again, work yourself backwards to that dynamic stretching. More advanced, you're going to squat down away and do it on the floor. Now, I'm not gonna be doing it perfectly in this video because, as you may know, I'm still recovering from an ankle injury. But you can get a lot of mobility from doing this in the chair. If you have any trouble with this, take a look at the rest of my posture and stretching videos. Maybe incorporate some of those into it to get more mobility. If you're still struggling, please contact my office for a free phone consultation, and we can see if we can get you feeling a lot better, either virtually or in our office in beautiful San Diego. Again, I'm Dr. Lindsay Trottier. Thanks and have a great day.